There's a different approach to healthcare that works better, and that's functional medicine. So how functional medicine is different from traditional medicine is that because we not only help you get to the root cause, we look at ranges. Let's use blood work as an example. What a lab will do when they check your ranges is they'll grab 20 people in your town or your city, and they'll find the mean of that number, and that will be the number that is considered healthy. What we do as functional medicine providers and practitioners is we look at what is optimal. Not only do we spend extra time studying to make sure we understand each system because they all work together, is we want to find that optimal number for you and make sure we're getting there or we are there and help you heal from the inside. So in functional medicine, we want to get to the root cause of your issue. So if you have brain fog, or if you're tired, you're wired but tired, you have some symptoms that your traditional medicine, either provider, physician or not, helping you get to the root cause, and we're just throwing band-aids, giving you medications, but you still don't feel great and you don't know why, that's where we come in as functional medicine providers and practitioners. We want to help you understand, why do you feel that way? What is causing you to feel that way? And depending on what's going on with you, there's different types of tests we may run to find the root cause of some of your symptoms or what's going on internally to help you heal. The reason I really got into functional medicine, I had my own issues and I was not getting answers. And even going back into the books, I'm like, I can't find this answer. I can't find this answer. So I figured out that none of my colleagues could have helped me at that point either. It was just Band-Aid on top of Band-Aid, which is either, birth control, here's this pill, here's this, here's that. Nothing was helping me until I decided to start studying functional medicine, and I figured out that I had, PCOS and some other issues there, not just PCOS, but also estrogen dominance at that point due to, all the toxins that are in our world right now. So we have so many toxins, and, even just drinking coffee, you're exposed to mold, and patients don't understand that unless you're getting coffee that is mold tested. So a lot of patients are experiencing different effects from things that can be easily fixed if we just dig a little deeper, right? Just go a little deeper, find the answer for that patient, and you'll get them feeling, 100% better usually within the next 6 months. We are going to dig, we are going to get to the root cause, and that's why we're here. We're not here to put band-aids. So having an open mind and understanding that tests need to be ran. This is a journey. The same way it took you 30, 40 years to get to where you are, sometimes 50, 60, it's going to take some time to heal as well. We will find the root cause of your issues, whether that be gut health, mold, Lyme. There's so many things that can happen with patients. We will help you heal. I've had patients who were supposed to have surgery and they didn't need to have surgery, right? Which can be really tough for somebody. They're not getting answers. They're going to multiple specialists. They're seeing multiple providers, physicians, and they're just not getting the answers they want. Or they're hitting a wall because nobody can tell them what's wrong. Well, it can be something as small as a parasite that you need to get rid of, or like we spoke about, it could be a mycotoxin, it could be heavy metals you need to get rid of, right? Something as small as that, but they're not checking for that. My approach to functional medicine is we're going to find answers. There is no fluff, right? We're going to get to the root cause and to what's going on with you and get you through that. I believe that everybody deserves somebody who cares and who wants to help them. And that's why I'm here. I'm not going to sugarcoat it for you. We're going to get to the reason, and we have to get everything done correctly. And if you follow that plan, we will get you the results and we will get you the answer. I don't think there's enough honesty in healthcare. You have to tell the patient what is really going on with them, right? We don't want to lie to you or tell you and then you can't get answers. I want you to get answers, and that's why there's no way around it. In functional medicine, you have to be 100% honest. Is it consistency with patients? Sometimes, yes. And I'll tell them, you're not being consistent enough. You have to give it time. There's many things that it could be. Do you not have the time? You need to make the time. Do you need to go to sleep earlier? There's so many lifestyle modifications that it could be too, but you have to tell the patient the truth. We want you to heal. That's the goal. We want you to heal. but this is already for people that have been dealing with functional medicine, that they'll run a bunch of tests on patients and they still don't get them answers, right? So if you've been dealing with a provider who's just not giving you answers and you've ran all the tests, that's why I'm the no fluff provider. That's why I'm going to help you. I feel bad. I've had patients that come to me before and they're like, I've had the hair test, I've had this test, I've had this test, but I still don't feel good. So you've spent $30,000-$40,000 even on like IVF, and they didn't run one hormone test on you. They're treating you for leaky gut and adrenal issues, but they're not getting to the root cause of those adrenal issues. So that's why we get to the point a little bit. We want to help. We need to. If you want to learn more about Eternity Health Partners, or if you have any questions for me directly, please leave a comment below or give us a call and we'll be happy to answer.